take it away whenever you're ready.
Alright, so to start off, I just want everyone to look at their feet. Like, what kind of shoes are you wearing? Can people kind of shout out what kind of brands of shoes you're wearing?
Vans.
Reebok.
American Eagle.
Taylor's.
What you got on, Brett? You don't know.
Okay, well, our presentation is on shoes and glasses that children in underdeveloped countries don't have. So, as you see, you're all wearing shoes, but in many countries, children they can't wear shoes because they can't afford them. So.
As she said, our presentation is on shoes and glasses for children in developing countries, and my name is Alan Scott.
Michael Walsacroft.
I'm Emily Crowder.
What's the social problem? The problem is children in developing countries lack shoes. All across the world, children of many different walks of life live without protection for their feet and glasses to help improve their sight. Being barefoot in certain places can be very hazardous to the health of children. The leading cause of disease in developing countries is soil-transmitted infection, which can penetrate the skin through bare feet. Shoes prevent your feet from getting cuts and sores, which are not only painful, but can become infected. One particular type of infection is called schistosomiasis, or STH. STH is a parasitic disease caused by trematode flatworms of the genus Schistosoma. About 200 million people, or 1 out of every 30 people, have STH. However, the mortality rate is very low, so it's not that much of a problem. Symptoms include fever, lack of appetite, weight loss, abdominal pain, weakness, headaches, joint and muscle pain, diarrhea, nausea, and coughing. Let's take a look at these two pictures. In this picture, you have children in a lesser developed country not wearing shoes, clearly, and because they're in a lesser developed country, that puts them more at risk of getting infections in their feet. In this picture, it shows the process that a particular infection takes to your body. You have the infection, it can then enter through your feet, it goes into your intestinal systems and your organs and just messes you up internally. And when they come out of you into your feces, they have eggs in your feces, so when it hits the ground, other people can step on them and it starts that process right back again. Now we want to talk about the health of children in a few particular countries. Dominican Republic, children suffer significant health and nutrition problems. The problems include general hygiene, malnutrition, the prevention of sexually transmitted diseases, cholera, malaria, chronic diarrhea, hepatitis A, and typhoid fever.
And next we have, find it. Cool. Ethiopia, the number one disease for Ethiopia is soil-transmitted parasites. Soil-transmitted parasites going straight through the foot. It's actually very scary. It literally will get through the foot and work its way up, and it's one of the number one killers for the entire Ethiopia area itself.
United Uganda, and some of its problems are malaria, unclean water, HIV and AIDS, and poor hygiene. And it actually has the highest proportion of children orphaned by HIV or AIDS. And a lot of its diseases are preventable, like prenatal and maternal illnesses and malaria. And also, over 56,000 children under the age of 5 die each year from nutrition-related causes. And because of them living in an underdeveloped country, many of them don't have shoes, so they get parasitic infections by that.
Now we'd like to talk about an organization that is creating solutions to make changes in the health of children. One is UNICEF, which stands for United Nations Children's Fund. They're an agency of the United Nations established in 1946 to help governments improve the health and education of children and their mothers. As you can see right here, the mission to work with others to overcome the obstacles that poverty, violence, disease, and discrimination placed in the child's path. UNICEF is active in more than 190 countries. Their plan is to help girls and women in particular. Their focus areas are HIV/AIDS, protection, education and gender equality, and policy and advocacy and partnership.
All right, next, another company is Tom's, which is very widely known in America and all across the country. So this is Blake Mycoskie. He's the one that actually created it. Now I'm going to tell you a little bit about him before I talk about his company. Blake Mycoskie believes everyone has a mission in life and that no one is truly living until they dedicate their life to pursuing it. He actually started 6 businesses from the ground up, including Tom's. So 5 before he did Tom's. In college, he started a laundry service that he later sold to his business partner when it reached to 8 other universities. Also, this is how he started to think about Tom's. While he was vacationing in South America in 2006, he discovered the alpargata, a rope-sole shoe worn by Argentine farmers for the last 100 years. After seeing children in Argentina who had no shoes and were too poor to afford them, he thought of the idea for his new company, Tom's Shoes. And now, like he was saying, he thinks everyone should have a desire to do something worthwhile in his life. It is now his desire to eliminate unnecessary human suffering through the distribution of new shoes. So this is where we start talking about Tom's. It's a one-for-one company where we buy a pair of these shoes and they'll send another pair of shoes to children in an underdeveloped country. And why shoes? Firstly, growing up barefoot. In many developing countries, children must walk barefoot for miles to go to school, to get medicine, and even clean water. Secondly, injury and disease. Hundreds of millions of children are at risk of injury, infection, and soil-transmitted diseases that most don't have the access to prevent or to treat. Thirdly, education and opportunity. Healthy, educated children have a better chance of improving the future of their community. And because of this, it's a part of their uniform to wear shoes. So if they cannot afford shoes, they cannot go to school, which hinders their education. And then fourthly, a better tomorrow. Like I was just saying, if they're educated, they are able to help their community as they grow. And not just their own little community, but the entire community as a whole. And I have this video that talks more about what he does and where it started. And so,
what if I started a shoe company and every time I sold a pair of shoes, I gave a pair away? And that way, if as long as I continue to keep selling shoes, these kids will have shoes for the rest of their life.
as you saw, these shoes right here, these are the most common type that they give because they're black, they're unisex, and they have a very sturdy sole. And you notice there's no shoelaces, and they decided to do this because when shoelaces break, most of the families can't afford to get more. So these are very good for their children because they just slip on. And like the video said, they continue to bring shoes to the same children, so as they grow, they're not just stuck with the same shoes or going back to being barefoot again.
Injury and disease. First off, a lot of these kids here are dealing with several issues, anywhere from eyesight to all the way down to their feet as well. Do you want me to go slide here? This button here. What is the social problem? Children in developing countries lack eyeglasses. Something that Tom's has done is they've actually directed sunglasses and regular eye-seeing glasses to each of these kids. These kids can range from anywhere from not seeing a chalkboard in a village all the way to the point where they cannot flat out see at all. And what Tom's is doing right now is they're actually matching every pair of shoes that's bought also with a pair of sunglasses and with glasses itself, and they're allowing these kids to see again. It's actually very incredible. I know with me, I had a big problem in the past with seeing. I had LASIK eye surgery last year. And this is something else that Tom's is doing now too, is they're doing surgeries. Cataracts is their #1 surgery. I didn't have that done, I had interlace done last year, but they're also doing that for adults. So it's expensive, but yet again, you're having eye doctors and surgeons take care of this thing and all at once. It's pretty incredible. So. Save the children. Our vision here is to change the world, which every child attains the right for survival, protection, development, and participation. With Save the Children, they're literally matching again. They're helping kids, once again, with development. These kids don't have any kind of sense of education, and without having shoes, without having proper nutrition and health, these kids are left hopeless. And this is something that Tom's and also Save the Children organizations helping on with as well.
So now, why sight? For Tom's, after years of just delivering shoes, he decided he wanted to be more than just a shoe-for-shoe company. But he realized that sight was a huge problem as well. And he decided to do sight because it's a fundamental need, and loss of sight affects a person in every area of their life. And also, firstly, it's a solvable crisis. Losing your eyesight and being blind is the 7th largest health disability in the world, but could be prevented or treated by medical treatment, glasses, or cataract surgery. Secondly, we can help break the poverty trap. What he meant by this was that 90% of people who are visually impaired live in developing countries. Poverty and disease can lead to vision loss, and this traps them in poverty because they can't afford to get glasses or eye surgery. Thirdly, sight means education and opportunity. Children who have trouble seeing are often unable to go or be successful in school. Fourthly, women have an equal right to sight. In developing countries, they're more likely to pay for men's surgery or men's glasses than they are for women's. But they can help women by providing easy-to-access local eye care. And there's also an immediate impact, meaning that they can provide glasses right then when they come, or they can provide 15-minute cataract surgery. Then we can create a better tomorrow. Children can go to school, adults can go to work, and their communities have a chance at a better future. And I also have another video, and this is talking about, because they just started this, and their first location was Nepal. And so it's him and his company going to Nepal, and they went there to find out how serious blindness really was there, and how the impact it was when they brought them glasses or surgery.
I think the #1 question I've got over the past few years is what's next? launching another product with the Tom's model, vision seemed the most obvious choice.
There are 165 million people in the world who have visual impairment. 1% of the population is blind.
Nepal seemed like a great opportunity. When we started this project, we knew nothing about saving or restoring vision. All we knew is that there was a great need.
With TOMS, we always work with local nonprofits and NGOs to understand really what the need is in a community before we just go in and start giving.
There is no reason for people to be unnecessarily blind. Majority of blinding conditions in the developing countries are either preventable or curable, like 80%.
I think what's really important to understand is just how powerful it is to help give sight to someone in need.
50% of the blind people are blind due to cataracts. It's also a condition which can be cured by surgery.
With Tom's Eyewear, we are able to give someone the opportunity to wear a pair of shades knowing that there's a much greater purpose.
With a simple pair of eyeglasses, the world comes into focus.
When they see the stripes and those colors, it will be a reminder that they have impacted someone's life in a one-for-one way.
Just this past September, we were able to give our 1 millionth pair of shoes to a child in need, and I can't wait for the day that we are able to say that we've given the 1 millionth person their sight back.
And as I was saying in the video, just they partner with expert eye care organizations, and they actually go to the community themselves, and they provide medical treatment, they provide glasses, or the 15-minute cataract surgery.
What have we done? We have addressed this issue by spreading the word about TOMS and other organizations like TOMS that have put into practice already. We've gone on Facebook and told our friends about these issues and these organizations. Hopefully our friends will follow our lead and spread the word further. We've also purchased products of these organizations that have the resources to make a difference in the lives of children in need. Emily, in fact, already has 3 pairs of TOMS shoes, so she's already making a difference herself. We've also participated in an event called One Day Without Shoes. One Day Without Shoes is an annual event held on April 5th of every year in which people across the world go a whole day without shoes. The purpose of this event is to spread awareness of the importance of shoes. And in this picture you have the process that the event is for, pretty much. You go a day without shoes, you walk barefoot, and that leads to a conversation with people about why you're barefoot, and hopefully that leads to a donation of money or shoes to children in need that makes a change in this world.
All right, how can you help? First off, educate yourself. Get to know yourself. Get to know the fact that TOMS is here to help people, save your life. All these organizations that we've actually had a chance to talk about today all want you to give your contributions and go ahead and tell other people. Like Emily's already told us about TOMS. She owns 3 pairs of shoes 5 times already. She's donated money to them. She's helped out these relief efforts. Also, tell others, as I already said before, it's all about one person telling somebody else. Pay it forward. You know, you tell somebody, that person's going to tell someone else. Before you know it, you have 1,000 people already involved, and that goes a long way in this world. So, and that really pretty much sums it up for us. Thank you very much. Thanks.